Hello guys, welcome to my channel Twasтрamanas. In this video, we are going to cover 6 types of counseling, and those are 1. Individual counseling, 2. Marriage couple counseling, 3. Family counseling, 4. Group counseling, 5. Career counseling, and 6. Substance abuse counseling. This video is going to be long, so feel free to take breaks in between. Let's start. Introduction to individual counseling. Individual counseling is a therapeutic process where a trained professional, known as a counselor or therapist, works one-on-one with a client to explore their thoughts, feelings, behaviors, and experiences in a safe and confidential environment. This type of counseling aims to help individuals understand themselves better, cope with challenges, and make positive changes in their lives. Importance of individual counseling. Individual counseling offers several benefits. 1. Personalized attention. Each client receives personalized attention and support tailored to their unique needs and circumstances. 2. Confidentiality. The confidential nature of individual counseling encourages clients to express themselves openly without fear of judgment. 3. Focused exploration. The focus on individual sessions allows for a deeper exploration of personal issues and concerns. 4. Goal-oriented approach. Counselors work collaboratively with clients to establish specific goals and develop strategies to achieve them. First stages of individual counseling. 1. Building rapport and establishing trust. The initial stage of individual counseling involves building a strong therapeutic relationship between the counselor and the client. This is essential for creating a safe and supportive environment where the client feels comfortable sharing their thoughts and feelings. Example: during the first session, the counselor may spend time getting to know the client, discussing the counseling process, and addressing any concerns or questions the client may have. This helps establish trust and rapport right from the beginning. 2. Assessment and goal setting. In this stage, the counselor collaborates with the client to assess their current situation, identify their strengths and challenges, and establish goals for therapy. Example: the counselor may use assessment tools such as questionnaires, interviews, or self-assessment exercises to gather information about the client's thoughts, emotions, and behaviors. Based on this assessment, the client and counselor work together to set specific, measurable, achievable, relevant, and time-bound SMART goals. 3. Exploration and insight. During this stage, the counselor helps the client explore their thoughts, feelings, and behaviors in greater depth to gain insight into underlying issues and patterns. Example: through open-ended questions, reflective listening, and empathetic responses, the counselor encourages the client to reflect on their experiences and gain a deeper understanding of themselves. This exploration may uncover past traumas, unhelpful beliefs, or recurring patterns that contribute to the client's current challenges. 4. Skill building and intervention. Once underlying issues are identified, the counselor introduces strategies and interventions to help the client develop coping skills, problem-solving abilities, and healthier ways of thinking and behaving. Example: depending on the client's needs, the counselor may teach relaxation techniques, communication skills, assertiveness training, or cognitive behavioral techniques to help the client manage stress, regulate emotions, and challenge negative thought patterns. 5. Application and practice. In this stage, the client applies the skills and strategies learned in therapy to real-life situations, practicing new behaviors and coping mechanisms outside of the counseling session. Example: the counselor and client may role-play challenging scenarios, create action plans for implementing new skills, and monitor progress over time. The client is encouraged to reflect on their experiences, identify what works well, and make adjustments as needed. 6. Review and termination. As therapy progresses and the client achieves their goals, the counselor and client collaboratively review the counseling process, reflect on the client's growth and accomplishments, and prepare for the conclusion of therapy. Example: in the final sessions, the counselor and client celebrate successes, discuss challenges overcome, and identify any remaining goals or areas for continued growth. Together, they develop a plan for maintaining progress after therapy ends and discuss the possibility of future sessions if needed. Tools and models of individual counseling. 1. Cognitive behavioral therapy, CBT. CBT is a widely used therapeutic approach that focuses on identifying and challenging negative thought patterns and beliefs to change unwanted behaviors and emotions. Example: a client experiencing social anxiety may use CBT techniques such as cognitive restructuring to challenge irrational beliefs about social situations and behavioral experiments to test out new coping strategies. 2. Solution-focused brief therapy, SFBT, is a goal-oriented approach that emphasizes finding solutions rather than dwelling on problems. It focuses on identifying strengths, resources, and solutions that the client already possesses. Example: instead of delving into the causes of depression, an SFBT counselor might ask the client to envision a future where they're no longer depressed and explore the small steps they can take to get there. 3. Person-centered therapy. Person-centered therapy, developed by Carl Rogers, emphasizes the importance of empathy, unconditional positive regard, and genuineness in the therapeutic relationship. It encourages clients to explore their feelings and experiences in a non-judgmental environment. Example: a person-centered counselor might listen empathetically as a client shares their struggles with self-esteem, offering validation and support without trying to provide solutions or advice. 4. Motivational interviewing. Motivational interviewing is a collaborative, goal-oriented approach that aims to help clients resolve ambivalence and make positive changes in their behavior. Example: a counselor using motivational interviewing might help a client explore their reasons for wanting to quit smoking, identify potential barriers to change, and develop a plan for achieving their goal. 5. Gestalt therapy. Gestalt therapy focuses on helping clients become more aware of their thoughts, feelings, and behaviors in the present moment. It encourages clients to take responsibility for their choices and actions. Example: during a Gestalt therapy session, a counselor might use empty chair techniques to help a client explore conflicting aspects of themselves or unresolved issues from their past. Conclusion: individual counseling is a valuable therapeutic process that offers clients the opportunity to explore their thoughts, feelings, and behaviors in a safe and supportive environment. By using the stages, tools, and models of counseling discussed in this guide, counselors can effectively help clients address their concerns, achieve their goals, and lead more fulfilling lives. Remember, the effectiveness of individual counseling depends on the quality of the therapeutic relationship, the client's willingness to engage in the process, and the counselor's skill in applying appropriate interventions. With dedication, empathy, and collaboration, counselors can make a meaningful difference in the lives of their clients through individual counseling. Introduction to Marriage Couple Counseling. Marriage and couple counseling, also known as couples therapy, is a form of therapy that focuses on improving the relationship between intimate partners. It is often sought out by couples experiencing difficulties or challenges in their relationship, such as communication problems, conflicts, infidelity, or issues with intimacy and trust. The primary goal of marriage just couple counseling is to help couples better understand each other, improve communication, resolve conflicts, and strengthen their bond. It provides a safe and supportive environment for couples to explore their feelings, thoughts, and behaviors within the relationship. In counseling, couples work with a trained therapist who facilitates discussions, offers guidance, and provides tools and techniques to help them overcome challenges and build a healthier relationship. Confidentiality is a key aspect of counseling, ensuring that couples feel comfortable sharing their concerns and vulnerabilities without fear of judgment or repercussions. Stage 1. Assessment and relationship history. The initial stage of marriage nor couple counseling involves gathering information about the couple's history, relationship dynamics, and presenting issues. This may include exploring each partner's background, family history, cultural influences, and previous experiences with relationships. Assessment tools such as questionnaires, genograms, visual representations of family relationships, and relationship inventories, surveys assessing various aspects of the relationship, may be used to gather relevant information. the counselor may also conduct individual interviews with each partner to gain a deeper understanding of their perspectives and concerns. For example, a couple presenting with frequent arguments over finances may undergo an assessment process to uncover underlying issues related to money management, attitudes towards spending and saving, and personal values around financial stability. Stage 2. Goal setting. Once the assessment is complete, the next stage involves collaboratively setting goals for counseling. This process allows couples to identify specific areas they want to work on and establish clear objectives for their sessions. Goals may be related to communication, conflict resolution, intimacy, trust building, or any other aspect of the relationship that requires attention. It is essential for couples to articulate both individual goals and shared relationship goals, ensuring that both partners feel invested in the counseling process. Setting realistic and achievable goals provides a roadmap for progress and helps couples stay focused on what they hope to accomplish. Continuing with the previous example, the couple experiencing financial conflicts may set goals such as improving communication about money, developing a budgeting plan together, and addressing underlying beliefs and attitudes towards finances. Stage 3. Psychoeducation and skills building. In this stage, couples receive psychoeducation about healthy relationship dynamics and learn practical skills and techniques to improve their communication, resolve conflicts, and enhance their connection. Psychoeducation involves providing information and insight into common relationship patterns, attachment styles, and communication strategies. Couples may learn techniques such as active listening, assertiveness training, empathy-building exercises, and problem-solving strategies. Role-playing and experiential exercises may be used to practice new skills in a supportive environment. For instance, the couple struggling with financial conflicts may participate in exercises to improve their financial literacy, learn effective budgeting techniques, and practice discussing money matters in a constructive and respectful manner. Stage 4. Exploration and understanding. During this stage, couples explore deeper issues and underlying dynamics within their relationship. They examine their thoughts, feelings, and behaviors to gain insight into patterns of interaction, unresolved conflicts, and emotional triggers. The counselor helps couples identify and explore factors contributing to relationship difficulties, such as past traumas, unmet needs, or differences in values and expectations. This process of exploration and understanding fosters empathy, compassion, and mutual understanding between partners. For example, the couple may uncover that their financial conflicts are rooted in deeper issues of insecurity, fear of scarcity, or differing beliefs about the purpose of money. By exploring these underlying dynamics, they can address core issues and work towards resolution. Stage 5. Change and action. In this stage, couples begin to implement strategies and interventions to address identified issues and achieve their goals. They actively work towards making positive changes in their relationship by applying the skills and techniques learned in counseling sessions. Couples may experiment with new behaviors, communication patterns, and problem-solving approaches. The counselor provides guidance, feedback, and support as couples navigate challenges and obstacles along the way. For instance, the couple may commit to practicing regular financial check-ins, setting aside time to discuss their financial goals, concerns, and priorities. They may also agree on specific action steps, such as creating a joint savings account or seeking financial counseling to address debt management. Stage 6. Consolidation and maintenance. In the final stage of counseling, couples reflect on their progress, consolidate gains, and establish strategies for maintaining their gains over time. They review the skills and insights gained during counseling and develop plans for continued growth and improvement in their relationship. Couples may create rituals or routines to support ongoing communication, connection, and mutual support. They may also identify potential triggers or challenges that could arise in the future and develop strategies for managing them effectively. For example, the couple may agree to schedule regular relationship check-ins to discuss their feelings, needs, and concerns openly. They may also establish boundaries around financial decision-making and commit to ongoing education and communication about money management. Conclusion: marriage and couple counseling is a collaborative process that empowers couples to overcome challenges, improve communication, and build stronger, more fulfilling relationships. By following the stages outlined above and actively engaging in the counseling process, couples can gain insight, develop skills, and create positive changes that last a lifetime. Remember, every couple's journey is unique, and counseling provides a safe and supportive space for couples to explore their relationship dynamics, address issues, and work towards a happier, healthier future together. If you and your partner are experiencing difficulties in your relationship, don't hesitate to seek out the support of a qualified marriage or couple counselor. With dedication, effort, and professional guidance, you can overcome obstacles and build a relationship that thrives. Family counseling is a specialized field within psychotherapy that focuses on improving communication, resolving conflicts, and enhancing relationships within families. In this guide, we will explore the stages, models, and tools commonly used in family counseling, along with real-life examples to illustrate their application. Stages of family counseling. 1. Assessment phase. Objective. The initial stage involves gathering comprehensive information about the family dynamics, history, and presenting issues. Tools. Various assessment tools such as genograms, family maps, questionnaires, and interviews are used. Example: the counselor conducts individual interviews with each family member to understand their perspective on family dynamics, communication patterns, and areas of concern. For instance, in a family where parents are arguing frequently, the counselor may discover through interviews that the children feel caught in the middle and are experiencing emotional distress as a result. 2. Goal setting. Objective. Collaboratively establish clear and achievable goals for counseling based on the assessment findings. Tools. SMART goals. Specific, measurable, achievable, relevant, time-bound, are often utilized to ensure clarity and effectiveness. Example: after assessing the family's issues, the counselor and family members agree that improving communication and reducing conflicts are primary goals for counseling. For instance, the family sets a SMART goal to have at least one family meal per week, without arguments or tension, aiming to improve overall communication and connection. 3. Intervention phase. Objective: implement strategies and techniques to address identified issues and achieve the established goals. Models. Various therapeutic models such as structural, strategic, Bowenian, narrative, and solution-focused are applied based on the specific needs of the family. Tools. Communication exercises, role-playing, reframing, boundary setting, and other interventions are utilized to facilitate positive change. Example: in a family experiencing frequent conflicts, the counselor employs role-playing exercises to help family members practice assertive communication and conflict resolution skills. For example, family members may role-play a recent argument and then switch roles to gain perspective and empathy for each other's experiences. 4. Evaluation and adjustment. Objective: regularly assess progress towards goals and make necessary adjustments to the therapeutic approach. Tools. Outcome measures, feedback sessions, and ongoing assessment of the family's functioning are conducted. Example: the counselor periodically reviews the family's progress towards their goals and adjusts interventions accordingly. If certain strategies are not yielding desired results, alternative approaches may be explored. For instance, if the family's conflict levels remain high despite communication exercises, the counselor may introduce additional techniques such as mindfulness or stress management to address underlying emotional triggers. Models of family counseling. Under 1. Structural family therapy. Overview. Developed by Salvador Minuchin, this model focuses on restructuring the family system to establish clear boundaries, hierarchies, and roles. Application. Example: a family struggling with power struggles and boundary issues may benefit from structural interventions aimed at clarifying roles and responsibilities. For instance, the counselor may work with the family to create a family chore chart and schedule to redistribute responsibilities and promote cooperation. 2. Strategic family therapy. Overview. Originated by Jay Haley and further developed by Chloe Medanes, this model emphasizes solving specific problems through directive interventions and strategic planning. Application. Example: a family facing challenges with adolescent defiance may benefit from strategic interventions aimed at implementing clear and consistent consequences for behavior. For example, the counselor may help the family develop a behavior contract outlining agreed-upon rules and consequences for non-compliance. 3. Bowenian Family Therapy. Overview. Developed by Murray Bowen, this model focuses on understanding and addressing intergenerational patterns of behavior, differentiation of self, and emotional triangles. Application example. A family struggling with enmeshment and emotional cutoffs may benefit from Bowenian interventions aimed at fostering individual autonomy and healthier boundaries. For instance, the counselor may encourage family members to maintain regular contact with extended family members while also prioritizing their own emotional well-being and independence. 4. Narrative Therapy. Overview. Developed by Michael White and David Epstein, this model externalizes problems and helps families rewrite their narratives, empowering them to separate from the influence of dominant problem-saturated stories. Example: a family grappling with a history of trauma may benefit from narrative interventions aimed at reframing their experiences and identifying strengths and resilience. For example, the counselor may assist the family in creating a collective narrative that emphasizes their ability to overcome challenges and support each other through difficult times. 5. Solution-Focused Therapy. Overview. Developed by Steve DeShazer and Insoo Kimberg, this model focuses on identifying strengths, resources, and solutions rather than dwelling on problems. Example: a family experiencing chronic conflict may benefit from solution-focused interventions aimed at amplifying moments of cooperation and building on existing strengths. For example, the counselor may encourage the family to identify times when they successfully resolved conflicts in the past and explore what strategies were effective in those situations. Tools used in family counseling. 1. Genograms. Overview. Visual representations of family relationships and dynamics, often spanning multiple generations. Example: the counselor collaborates with the family to create a genogram which provides valuable insights into family patterns, relationships, and potential sources of conflict. For example, the genogram may reveal a history of divorce or substance abuse that contributes to current family dynamics. 2. Communication exercises. Overview. Activities designed to improve communication skills within the family, such as active listening, assertiveness training, and conflict resolution techniques. Example: the counselor leads the family in communication exercises, such as mirroring and paraphrasing, to enhance empathy, understanding, and mutual respect. For example, family members may practice active listening by taking turns expressing their feelings and summarizing each other's perspectives without judgment. 3. Questionnaires and inventories. Overview. Structured assessments used to gather information about family functioning, communication patterns, and areas of concern. Example: the counselor administers validated questionnaires and inventories, such as the Family Assessment Device, FAD, or the Circumplex Model, to assess the family's strengths and challenges. For example, the questionnaire may reveal high levels of conflict and low levels of cohesion within the family, highlighting areas that need attention. 4. Role-playing. Overview. Technique used to explore different perspectives, practice new behaviors, and develop empathy within the family. Example: family members engage in role-playing exercises to simulate challenging situations and experiment with alternative ways of responding, fostering insight and skill development. For example, parents may role-play a disagreement about parenting styles and then brainstorm collaborative solutions to address their differences. 5. Homework assignments. Overview. Tasks assigned between counseling sessions to reinforce therapeutic goals, practice new skills, and promote generalization of learning. Example: the counselor assigns homework tasks such as journaling exercises, communication challenges, or collaborative problem-solving activities tailored to the family's specific needs and goals. For example, the family may be asked to keep a gratitude journal and share their entries with each other at the next session to promote positivity and connection. Conclusion: family counseling is a multifaceted and dynamic process aimed at promoting understanding, collaboration, and positive change within families. By employing a variety of stages, models, and tools, counselors can empower families to navigate challenges, strengthen relationships, and cultivate resilience. Effective family counseling requires a strengths-based approach, cultural sensitivity, and a commitment to fostering meaningful and lasting transformation within the family system. Group counseling is a dynamic and powerful therapeutic approach that harnesses the collective wisdom, support, and shared experiences of individuals facing similar challenges or goals. It is guided by various stages, models, and tools designed to facilitate growth, healing, and personal development within a group setting. Let's delve into the intricacies of group counseling, exploring its stages, models, and tools while weaving in real-life examples to illustrate their application. Stages of group counseling. 1. Formation stage. In this initial stage, members acquaint themselves with one another, and the group's purpose is established. Trust and rapport building are crucial during this phase. For instance, in a group aimed at helping survivors of domestic violence, members may share their stories tentatively, gauging each other's reactions and forming connections based on shared experiences. Example: in a group for survivors of natural disasters, such as hurricanes or wildfires, members may initially share basic information about their experiences, such as where they were when the disaster occurred and how it affected them. Trust begins to form as individuals realize they are among others who have faced similar challenges. 2. Orientation stage. Here, the group's norms, rules, and goals are clarified, setting the tone for future interactions. A counselor may outline confidentiality agreements and encourage active participation. In a group focused on addiction recovery, members might discuss the importance of honesty and confidentiality, establishing a safe space for vulnerability. Example: in a group for parents of children with autism spectrum disorder, ASD, the counselor may outline group norms such as respecting confidentiality and practicing active listening. Members may express relief at finding a safe space where they can openly discuss their fears and frustrations without judgment. 3. Transition stage. This phase is marked by increased openness and self-disclosure as members begin to identify with the group and its purpose. Bonds strengthen, and individuals may confront resistance or ambivalence towards change. For example, in a grief support group, members may express feelings of anger or guilt as they navigate the complexities of loss. Example: in a group for individuals recovering from substance abuse, members may start to disclose personal struggles with addiction and their motivations for seeking help. As they witness others' courage in sharing their stories, individuals begin to feel less alone in their journey towards recovery. 4. Working stage. The crux of group counseling. This stage involves deep exploration, processing, and problem-solving. Members offer and receive support, challenge each other's perspectives, and explore new coping strategies. In a group for adolescents struggling with self-esteem, members might engage in role-playing exercises to practice assertiveness and challenge negative self-talk. Example: in a group for individuals with chronic pain, members might engage in discussions about pain management techniques and share their experiences with different treatments. Through mutual support and feedback, members explore new coping strategies and challenge limiting beliefs about their pain. 5. Consolidation stage. As the group nears its conclusion, members reflect on their growth, accomplishments, and challenges. Closure rituals are introduced, and plans for maintaining progress are discussed. In a group addressing social anxiety, members might create individualized exposure plans to continue facing feared situations outside of the group context. Example: in a group for caregivers of Alzheimer's patients, members reflect on the progress they've made in accepting their loved one's condition and managing caregiver stress. They discuss strategies for self-care and vow to continue supporting each other beyond the group sessions. 6. Termination stage. In this final stage, the group formally concludes, and members bid farewell to one another. Emotions may range from sadness to gratitude as individuals reflect on their journey together. Follow-up resources and support networks are provided to facilitate continued growth. In a veteran support group, members might exchange contact information and commit to staying connected post-group to provide ongoing support. Example: In a group for veterans struggling with PTSD, members express gratitude for the support they've received and the progress they've made in coping with their trauma. While saying goodbye is bittersweet, they exchange contact information and commit to staying connected for ongoing support. Models of group counselling. 1. Psychoeducational model. This model emphasizes the acquisition of knowledge and skills to address specific issues or challenges. In a group focused on stress management, members might learn about the physiological effects of stress and practice relaxation techniques such as deep breathing and mindfulness. Example: in a group for individuals with type 2 diabetes, members learn about the importance of diet, exercise, and medication adherence in managing their condition. They receive practical tips for meal planning and exercise routines to empower them in their self-care journey. 2. Cognitive behavioral model. Rooted in cognitive restructuring and behavior modification, this model targets maladaptive thoughts and behaviors. In a group addressing depression, members might identify cognitive distortions and practice reframing negative thoughts using evidence-based techniques like cognitive restructuring. Example: in a group for adolescents with anxiety disorders, members identify common cognitive distortions such as catastrophizing or black and white thinking. Through cognitive restructuring exercises, they challenge these distortions and develop more adaptive ways of thinking about their fears. 3. Interpersonal process model. This model explores the dynamics of interpersonal relationships within the group as a microcosm of broader social interactions. In a group for individuals with social anxiety, members might explore patterns of avoidance and engage in role plays to practice assertive communication and boundary setting. Example: in a group for LGBTQ+ youth, members explore their experiences of discrimination and social rejection, as well as their strategies for building supportive relationships. Role-playing exercises help them practice assertive communication and boundary setting in various social contexts. 4. Psychoanalytic model. Drawing from Freudian theory, this model delves into unconscious conflicts and defense mechanisms that shape behavior. In a group for individuals with unresolved trauma, members might explore how early experiences influence present-day relationships and coping strategies. Example: in a group for adults with unresolved childhood trauma, members explore how their early experiences shape their current patterns of relating to others and coping with stress. Through dream analysis and free association exercises, they uncover unconscious conflicts and defense mechanisms. 5. Existential humanistic model. Focused on themes of self-awareness, authenticity, and personal responsibility, this model encourages individuals to confront existential concerns and embrace their inherent freedom. In a group exploring life transitions, members might reflect on the meaning of change and existential themes such as death and meaninglessness. Example: in a group for individuals facing existential crises, such as a midlife crisis or loss of meaning, members reflect on their values, goals, and the legacy they want to leave behind. Through existential exploration, they find renewed purpose and a sense of authenticity in their lives. Tools of group counseling. 1. Icebreakers. These activities are used to foster group cohesion and create a comfortable atmosphere. In a group for adolescents with behavioral issues, an icebreaker activity might involve sharing one interesting fact about oneself to break the ice and promote engagement. Example: in a group for survivors of sexual assault, an icebreaker activity might involve creating a collage that represents their journey towards healing. This creative exercise helps break down barriers and fosters a sense of solidarity among group members. 2. Therapeutic exercises. These structured activities facilitate exploration, insight, and skill building. In a group for individuals with anger management issues, a therapeutic exercise might involve identifying triggers, exploring coping strategies, and practicing assertive communication through role plays. Example: in a group for individuals with anger management issues, members might participate in a role-playing exercise where they practice assertive communication and conflict resolution strategies. This hands-on approach allows members to apply new skills in a safe and supportive environment. 3. Process reflection. Group members and the counselor reflect on the group's dynamics, interactions, and themes to promote insight and self-awareness. In a group for individuals with eating disorders, process reflection might involve exploring patterns of competition or comparison that emerge during discussions about body image. Example: in a group for adults with depression, the counselor facilitates discussions about the group's emotional climate and members' interactions. Process reflection helps individuals gain insight into how their thoughts and behaviors impact the group dynamics and their own well-being. 4. Journaling. Writing exercises encourage self-reflection, emotional expression, and goal setting. In a group for survivors of trauma, journaling prompts might invite members to explore their feelings of safety, trust, and empowerment as they progress through the healing journey. Example: in a group for survivors of childhood abuse, members are encouraged to keep a journal where they can express their thoughts, feelings, and memories in a safe and private space. Journaling promotes self-reflection and emotional processing outside of the group sessions. 5. Guided imagery. Visualization exercises tap into the power of imagination to promote relaxation, emotional processing, and perspective taking. In a group for individuals with chronic pain, guided imagery might involve visualizing a peaceful scene to reduce stress and manage pain perception. Example: in a group for cancer patients undergoing chemotherapy, guided imagery exercises help members visualize their bodies healing and regaining strength. This imagery fosters a sense of hope and resilience in the face of physical and emotional challenges. In the intricate landscape of career choices, navigating the path to a fulfilling and successful career can be a daunting task. This is where the invaluable guidance of career counseling comes into play. Career counseling employs a variety of stages, models, and tools to assist individuals in exploring their interests, skills, values, and goals, ultimately helping them make informed career decisions. Let's delve into the depths of career counseling and uncover the essence of each stage, model, and tool, along with real-world examples illustrating their application. 1. Exploration stage. The exploration stage sets the foundation for the career counseling process, encouraging individuals to reflect on their interests, values, personality traits, and skills. One widely used tool in this stage is the self-directed search, SDS, which helps individuals identify their Holland codes based on their preferences for certain work environments and activities. For example, a recent college graduate, uncertain about their career path, might take the SDS assessment and discover a strong preference for investigative tasks, guiding them towards careers in research or analysis. 2. Assessment stage. In the assessment stage, career counselors utilize various assessment tools to gather information about clients' aptitudes, abilities, and career-related preferences. The Myers-Briggs Type Indicator, MBTI, is a prominent tool used to assess personality types, providing insights into how individuals perceive the world and make decisions. For example, an individual with an ENFJ personality type, characterized by strong interpersonal skills and a desire to help others, might be drawn to careers in counseling, teaching, or human resources. 3. Goal setting. Stage. Once individuals have explored their interests and assessed their abilities, the goal-setting stage comes into play, helping them articulate their career aspirations and establish achievable goals. The SMART goal-setting framework, which emphasizes goals that are specific, measurable, achievable, relevant, and time-bound, is often employed in this stage. For instance, a mid-career professional aiming to transition into a leadership role might set a SMART goal to complete a relevant certification within the next 6 months, paving the way for career advancement. 4. Decision-making stage. The decision-making stage is where individuals weigh their options, considering factors such as job prospects, salary potential, work-life balance, and personal values. One model frequently used in this stage is the expected utility theory, which posits that individuals make rational decisions by assessing the expected outcomes and probabilities associated with each option. For example, a recent graduate deliberating between job offers may use this model to evaluate the potential long-term benefits and drawbacks of each opportunity before making a decision. 5. Action planning stage. In the action planning stage, individuals translate their career goals into actionable steps, developing a strategic plan to achieve their objectives. The GROW model, which stands for Goal, Reality, Options, and Will, provides a structured framework for setting objectives and identifying the necessary actions to accomplish them. For instance, an aspiring entrepreneur utilizing the GROW model might set a goal to launch a startup within the next year, assess the current market reality, explore funding options, and commit to taking consistent action towards building their business. 6. Implementation stage. The implementation stage is where individuals put their action plans into motion, taking concrete steps towards realizing their career aspirations. Career counselors often provide support and encouragement during this stage, helping clients navigate challenges and stay focused on their goals. For example, a professional undergoing a career transition might leverage networking opportunities, attend industry events, and seek mentorship to facilitate their journey towards a new role or industry. 7. Evaluation stage. Finally, the evaluation stage involves reflecting on progress, reassessing goals, and making any necessary adjustments to the career plan. One tool commonly used in this stage is the SWOT analysis, which helps individuals identify their strengths, weaknesses, opportunities, and threats in relation to their career objectives. For instance, a mid-career professional reassessing their career trajectory may conduct a SWOT analysis to identify areas for skill development, potential career advancements, and external factors that could impact their career path. Models of counseling. 1. Expected utility theory. Expected utility theory is a model frequently employed in the decision-making stage of career counseling. It posits that individuals make rational decisions by assessing the expected outcomes and probabilities associated with each option. This model helps individuals evaluate various career opportunities based on factors such as job prospects, salary potential, work-life balance, and personal values. For example, a recent graduate may use expected utility theory to weigh the potential long-term benefits and drawbacks of different job offers before making a decision. Example: Sarah, a recent graduate, is considering 2 job offers. Job A offers a higher salary but requires extensive travel, while Job B offers a lower salary but provides opportunities for professional development and a better work-life balance. By applying expected utility theory, Sarah evaluates the potential outcomes and probabilities associated with each option. She considers the long-term impact on her career growth, personal well-being, and job satisfaction before making her decision. 2. GROW model. The GROW model, which stands for Goal, Reality, Options, and Will, provides a structured framework for setting objectives and identifying the necessary actions to achieve them. This model is often utilized in the action planning stage of career counseling, where individuals translate their career goals into actionable steps. For instance, a professional seeking to advance their career might use the GROW model to set specific goals, assess the current reality of their situation, explore available options, and commit to taking concrete actions towards their objectives. Example: John, an experienced professional, is feeling stagnant in his current role and desires career advancement. Using the GROW model, John sets a specific goal of obtaining a leadership position within his organization. He assesses the reality of his current skill set and identifies areas for improvement. John explores various options for career advancement, such as pursuing additional training or seeking mentorship. With a clear action plan in place, John takes proactive steps towards achieving his goal, including networking with senior leaders and taking on challenging projects to demonstrate his leadership potential. 3. SWOT analysis. The SWOT analysis is a tool commonly used in the evaluation stage of career counseling. It helps individuals identify their strengths, weaknesses, opportunities, and threats in relation to their career objectives. This analysis enables individuals to gain a comprehensive understanding of their internal capabilities and external factors that may impact their career path. For example, a mid-career professional conducting a SWOT analysis may identify opportunities for skill development, potential career advancements, as well as external threats such as industry disruptions or economic downturns. Example: Emily, a marketing manager, conducts a SWOT analysis to evaluate her career prospects. She identifies her strengths in strategic planning and project management, along with weaknesses in digital marketing skills. Emily recognizes opportunities for career growth within her industry, such as expanding into new markets or specializing in emerging technologies. However, she also acknowledges threats such as industry competition and economic uncertainty. By leveraging her strengths and addressing her weaknesses, Emily develops a plan to enhance her digital marketing expertise and capitalize on opportunities for career advancement. Tools of counseling. 1. Self-directed search, SDS. The self-directed search, SDS, is a widely used tool in the exploration stage of career counseling. It helps individuals identify their Holland codes, which are based on their preferences for certain work environments and activities. For example, a recent college graduate unsure about their career path may take the SDS assessment and discover a strong preference for investigative tasks, guiding them towards careers in research or analysis. Example: Alex, a college student, is undecided about his career path. He takes the self-directed search, SDS assessment, and discovers a strong preference for investigative and artistic activities. Based on his results, Alex explores career options in fields such as graphic design, architecture, and forensic science. He conducts informational interviews with professionals in these fields and participates in internships to gain hands-on experience and clarify his career goals. 2. Myers-Briggs Type Indicator, MBTI. The Myers-Briggs Type Indicator, MBTI, is a prominent tool used in the assessment stage of career counseling. It assesses personality types and provides insights into how individuals perceive the world and make decisions. For instance, an individual with an ENFJ personality type, characterized by strong interpersonal skills and a desire to help others, might be drawn to careers in counseling, teaching, or human resources. Example: Sarah, a recent graduate, takes the Myers-Briggs Type Indicator, MBTI assessment, and discovers that she has an ENFP personality type. Sarah learns that ENFPs are creative, energetic, and value autonomy in their work. Armed with this insight, Sarah explores career options that align with her personality traits, such as advertising, event planning, or entrepreneurship. She seeks out opportunities that allow her to express her creativity, collaborate with others, and make a positive impact on her community. 3. SMART Goal-Setting Framework. The SMART Goal-Setting Framework is utilized in the goal-setting stage of career counseling. It emphasizes setting goals that are specific, measurable, achievable, relevant, and time-bound. For example, a mid-career professional aiming to transition into a leadership role might set a SMART goal to complete a relevant certification within the next 6 months, paving the way for career advancement. Incorporating these models and tools into career counseling sessions empowers individuals to make informed decisions, set achievable goals, and navigate their career paths with clarity and confidence. By leveraging these resources, career counselors can support their clients in exploring their interests, assessing their abilities, and ultimately pursuing fulfilling and rewarding career opportunities. Example: Mark, a sales professional, sets a SMART goal to increase his sales performance by 15% within the next quarter. He outlines specific strategies to achieve this goal, including expanding his client base, improving product knowledge, and refining his sales pitch. Mark tracks his progress regularly, adjusting his approach as needed to stay on track towards achieving his goal. By applying the SMART framework, Mark maintains focus, accountability, and motivation to succeed in his sales career. Introduction. Substance abuse counseling is a vital field that aims to assist individuals struggling with addiction to substances such as alcohol, drugs, or prescription medications. It encompasses a range of therapeutic approaches, stages, models, and tools designed to support individuals in overcoming addiction and reclaiming their lives. In this comprehensive guide, we will delve into the various aspects of substance abuse counseling, exploring the stages of counseling, prominent counseling models, and essential tools utilized in the field. Stages of substance abuse counseling. 1. Assessment stage, in-depth evaluation. This phase involves a thorough examination of the client's substance use history, including frequency, duration, and quantity of substance consumption. Additionally, counselors explore the client's medical history, family dynamics, social support systems, co-occurring mental health disorders, and any past experiences with treatment. Through detailed assessments, counselors gain insight into the client's strengths, challenges, and readiness for change. Screening instruments. Counselors may utilize standardized screening tools such as the Substance Abuse Subtle Screening Inventory, SASI, Addiction Severity Index, ASI, or Drug Abuse Screening Test, DST, to gather quantitative data and identify specific areas of concern. These instruments help counselors to objectively assess the severity of substance use disorders and tailor treatment plans accordingly. Establishing rapport. Building a therapeutic alliance is paramount during the assessment stage. Counselors establish trust and rapport with clients by demonstrating empathy, active listening, and non-judgmental attitudes. Creating a safe and supportive environment encourages clients to disclose sensitive information and actively engage in the counseling process. Collaborative goal setting. Through collaborative discussions, counselors and clients establish mutually agreed upon treatment goals based on the client's desires, strengths, and priorities. Setting realistic and achievable goals enhances client motivation and fosters a sense of ownership and commitment to the therapeutic process. Example: during an assessment, a counselor may conduct interviews, administer questionnaires, and review medical records to gain a comprehensive understanding of the client's substance use. 2. Treatment planning. Stage: individualized care plans. Treatment plans are tailored to address the unique needs, preferences, and circumstances of each client. Counselors draw upon assessment findings, clinical expertise, and evidence-based practices to develop comprehensive care plans that encompass various domains, including medical, psychological, social, and spiritual dimensions. Holistic approach. Effective treatment plans adopt a holistic approach that considers the interconnectedness of physical, emotional, cognitive, and environmental factors influencing substance use behaviors. Integrating interventions such as medication-assisted treatment, MAT, individual therapy, group therapy, family therapy, and adjunctive services ensures a multifaceted approach to recovery. Strengths-based perspective. Recognizing and harnessing the client's inherent strengths, resilience, and support systems is integral to treatment planning. Empowering clients to leverage their strengths and external resources fosters self-efficacy, self-determination, and resilience in overcoming challenges associated with substance abuse. Continuum of care. Treatment plans outline a continuum of care that addresses clients' evolving needs across different stages of recovery, from detoxification and stabilization to relapse prevention and aftercare services. Counselors coordinate a seamless transition between levels of care to optimize treatment outcomes and long-term recovery. Example: a counselor may work with a client to identify triggers for substance use and develop coping strategies to manage cravings and avoid relapse. 3. Intervention stage. Evidence-based interventions. Counselors employ a repertoire of evidence-based interventions tailored to address the specific needs and goals of clients. These interventions may include cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, motivational interviewing, MI, contingency management, and 12-step facilitation programs. Psychoeducation, educating clients about the neurobiology of addiction, the cycle of change, and coping strategies enhances their understanding of substance use disorders and equips them with essential knowledge and skills for recovery. Psychoeducation also addresses common misconceptions, stigma, and barriers to seeking help. Skill building. Clients acquire and practice coping skills, emotion regulation techniques, and problem-solving strategies to manage cravings, cope with stressors, and navigate high-risk situations without resorting to substance use. Skill-building exercises empower clients to develop adaptive behaviors and enhance their resilience in the face of triggers and temptations. Relapse prevention. Anticipating and effectively managing relapse is a critical component of intervention. Counselors collaborate with clients to identify triggers, early warning signs, and coping mechanisms to prevent relapse and maintain long-term sobriety. Relapse prevention plans incorporate personalized strategies, social support networks, lifestyle modifications, and emergency action plans to mitigate the risk of recurrence. Example: counselors may utilize cognitive behavioral therapy, CBT, motivational interviewing, MI, group therapy, or family therapy to address underlying issues contributing to substance abuse. 4. Monitoring and evaluation stage. Ongoing assessment. Regular monitoring of client progress allows counselors to track changes in substance use behaviors, mental health symptoms, and psychosocial functioning over time. Objective measures, self-report assessments, and collateral information from collaterals inform the ongoing evaluation of treatment effectiveness and guide modifications to the care plan as needed. Outcome measurement. Evaluating treatment outcomes involves assessing the achievement of predefined goals and objectives related to substance use reduction, improved quality of life, and enhanced functional impairment. Outcome measures may include abstinence rates, relapse rates, improvements in psychiatric symptoms, social functioning, and client satisfaction with treatment. Treatment adherence. Monitoring client adherence to treatment recommendations, medication regimens, and therapeutic interventions is essential for optimizing treatment outcomes and preventing dropout or disengagement from services. Identifying barriers to treatment adherence and addressing client concerns or ambivalence promotes treatment, retention, and continuity of care. Feedback and collaboration. Soliciting feedback from clients about their experiences with treatment, perceived benefits, and areas for improvement fosters a collaborative and client-centered approach to evaluation. Regular communication and collaboration between counselors, clients, interdisciplinary treatment teams, and external stakeholders facilitate comprehensive assessment and continuous quality improvement in substance abuse counseling services. Example: counselors may regularly assess the client's substance use behaviors, mental health symptoms, and overall functioning to gauge the effectiveness of interventions and modify the treatment plan accordingly. Prominent counseling models in substance abuse. Counseling. 1. Biopsychosocial model. Biological factors, genetic predispositions, neurobiological alterations, and pharmacological mechanisms contribute to the development and maintenance of substance use disorders. Understanding the biological underpinnings of addiction informs targeted interventions, medication management, and harm reduction strategies tailored to individual needs. Psychological factors, psychological vulnerabilities, cognitive distortions, emotional dysregulation, and maladaptive coping mechanisms play a significant role in the etiology and perpetuation of substance abuse. Addressing underlying psychological issues through psychotherapy, cognitive restructuring, and emotion-focused interventions promotes sustainable recovery and emotional well-being. Social factors, socio-environmental influences, interpersonal relationships, socioeconomic status, cultural norms, and social support networks influence patterns of substance use and treatment outcomes. Interventions targeting social determinants of health, family dynamics, peer influences, and community resources enhance clients' social connectedness, resilience, and recovery capital. Integrated treatment approach. The biopsychosocial model advocates for an integrated treatment approach that addresses biological, psychological, and social dimensions of substance use disorders concurrently. Coordinated care delivery, interdisciplinary collaboration, and holistic interventions maximize treatment effectiveness and support long-term recovery. Example: a counselor using this model would consider genetic predispositions, psychological vulnerabilities, and social environments when assessing and treating substance use disorders. 2. Stages of change model, trans-theoretical model, pre-contemplation. Stage. Clients in this stage are not yet considering change and may exhibit denial, resistance, or minimization of their substance use problems. Motivational interventions focus on raising awareness, increasing ambivalence, and exploring the pros and cons of change to stimulate contemplation. Contemplation stage. Clients in this stage are aware of the need for change, but may feel conflicted or uncertain about taking action. Motivational interviewing techniques facilitate exploration of personal values, goals, and motivations for change, thereby enhancing readiness and commitment to treatment. Preparation. Stage. Clients in this stage are actively planning and preparing for change, often seeking information, support, and resources to facilitate their efforts. Collaborative goal setting, problem solving, and decision-making strategies empower clients to overcome barriers and take concrete steps toward behavior change. Action stage. Clients in this stage are actively engaged in modifying their substance use behaviors and implementing coping strategies to achieve their treatment goals. Skill-building exercises, relapse prevention planning, and social support networks reinforce positive changes and promote sustained abstinence. Maintenance stage. Clients in this stage are focused on consolidating gains, maintaining lifestyle changes, and preventing relapse over the long term. Ongoing support, monitoring, and coping skills practice help clients navigate challenges, cope with stressors, and reinforce positive habits to sustain recovery. Relapse prevention. Stage. Clients in this stage have experienced setbacks or lapses in their recovery journey and require targeted interventions to identify triggers, address underlying issues, and re-engage in treatment. Relapse prevention planning, crisis management, and adaptive coping strategies promote resilience and facilitate reintegration into recovery-oriented activities. Example: a counselor working with a client in the contemplation stage might focus on increasing awareness of the consequences of substance use and exploring ambivalence about change. 3. Cognitive behavioral model, cognitive restructuring, cognitive behavioral therapy, CBT, targets maladaptive thoughts, beliefs, and attitudes that contribute to substance use behaviors. Clients learn to identify and challenge irrational cognitions, cognitive distortions, and cognitive biases that reinforce addictive patterns and undermine recovery efforts. Behavioral modification. Behavioral interventions focus on modifying reinforcement contingencies, learning principles, and environmental cues associated with substance use. Clients acquire adaptive coping skills, problem-solving strategies, and assertiveness training techniques to replace addictive behaviors with healthier alternatives. Functional analysis. Functional analysis helps clients identify antecedents, behaviors, and consequences of substance use episodes to understand the function or purpose they serve. By examining triggers, cravings, and coping responses, clients gain insight into the contextual factors driving their addictive behaviors and develop personalized relapse prevention strategies. Skill acquisition. Cognitive behavioral therapy emphasizes skill acquisition and rehearsal to enhance clients' ability to cope with high-risk situations, manage cravings, and navigate interpersonal challenges without resorting to substance use. Role-playing, modeling, and experiential exercises facilitate skill development and promote generalization to real-world settings. Example: a counselor employing cognitive behavioral techniques might help a client identify and challenge irrational thoughts and develop alternative coping skills to manage cravings and triggers. 4. Motivational enhancement. Therapy, client-centered approach. Motivational enhancement therapy, MET, adopts a client-centered, collaborative approach that honors clients' autonomy, strengths, and intrinsic motivations for change. Counselors evoke and amplify clients' inherent readiness, confidence, and commitment to pursuing healthier behaviors and values. Exploring ambivalence. Motivational interviewing techniques help clients explore and resolve ambivalence about change by examining the pros and cons of their current substance use behaviors. By eliciting discrepancies between clients' goals and behaviors, counselors stimulate cognitive dissonance and facilitate motivation for change. Developing discrepancy. MET encourages clients to articulate their aspirations, values, and long-term goals, highlighting discrepancies between their current behaviors and desired outcomes. By enhancing awareness of the disparity between where clients are and where they want to be, counselors evoke a sense of cognitive dissonance and motivation for change. Building self-efficacy. MET fosters clients' self-efficacy and confidence in their ability to overcome challenges, cope with setbacks, and achieve their treatment goals. Through collaborative goal setting, problem solving, and skills training, clients develop a sense of mastery and empowerment in navigating the recovery process. Example: a counselor using motivational enhancement therapy might explore the client's values, goals, and aspirations to increase their motivation to reduce or abstain from substance use. Essential tools in substance abuse counseling. 1. Motivational interviewing. Expressing empathy. Motivational interviewing, MI, begins with the counselor expressing empathy and understanding toward the client's experiences, feelings, and perspectives. By adopting a non-judgmental, empathic stance, counselors create a safe and supportive atmosphere conducive to open dialogue and self-exploration. Developing discrepancy. MI techniques help clients recognize and resolve discrepancies between their current behaviors and their values, goals, and aspirations. By eliciting and amplifying ambivalence about change, counselors evoke clients' intrinsic motivations and enhance their readiness for behavior change. Rolling with resistance. MI acknowledges and respects clients' autonomy, resistance, and reluctance to change. Rather than confronting or challenging resistance directly, counselors adopt a collaborative, non-confrontational approach that validates clients' perspectives and encourages exploration of alternative viewpoints. Supporting self-efficacy. MI aims to bolster clients' self-efficacy and confidence in their ability to change by highlighting past successes, strengths, and coping resources. Through affirmations, reflective listening, and positive reinforcement, counselors cultivate a sense of hope, optimism, and empowerment in clients' recovery journey. Example: a counselor using motivational interviewing might employ open-ended questions, reflective listening, and affirmations to evoke the client's intrinsic motivation for change. 2. Relapse prevention planning. Identifying triggers. Relapse prevention planning involves identifying high-risk situations, internal cues, and external triggers that may precipitate substance use, cravings, or relapse. Clients learn to recognize early warning signs such as stress, negative emotions, interpersonal conflicts, or environmental cues, and develop coping strategies to manage these triggers effectively. Coping skills. Development. Clients acquire a repertoire of coping skills, relaxation techniques, and stress management strategies to cope with triggers and cravings without resorting to substance use. Cognitive behavioral techniques, mindfulness practices, and assertiveness training empower clients to respond adaptively to challenging situations and maintain abstinence. Social support networks. Building and mobilizing social support networks is crucial for relapse prevention. Clients identify supportive individuals, recovery-oriented communities, and peer networks that can provide encouragement, accountability, and practical assistance in times of need. Strengthening social connections reduces feelings of isolation and enhances resilience in recovery. Lifestyle modifications. Adopting healthy lifestyle habits, routines, and recreational activities promotes overall well-being and reduces the risk of relapse. Clients engage in regular exercise, nutrition planning, sleep hygiene practices, and leisure pursuits that enhance physical health, emotional balance, and self-care in recovery. Example: a counselor might work with a client to create a relapse prevention plan that includes coping skills, social support networks, and healthy lifestyle choices to maintain sobriety. 3. Psychoeducation, understanding addiction. Psychoeducation provides clients with accurate information about the nature of addiction, its neurobiological underpinnings, and its impact on physical, psychological, and social functioning. By dispelling myths, misconceptions, and stigma surrounding substance use disorders, clients gain insight into their condition and feel empowered to seek help. Learning coping strategies. Psychoeducation equips clients with practical coping strategies, problem-solving skills, and emotion regulation techniques to manage cravings, triggers, and stressors without resorting to substance use. Clients learn to identify early warning signs, implement harm reduction strategies, and access appropriate support resources in times of need. Exploring treatment options. Psychoeducation educates clients about available treatment options, including outpatient counseling, residential rehabilitation, medication-assisted treatment, MAT, mutual support groups, and complementary therapies. Informed decision-making and treatment engagement are facilitated by providing clients with information about the benefits, risks, and alternatives to various interventions. Preventing relapse. Psychoeducation on relapse prevention helps clients anticipate common relapse triggers, recognize warning signs of impending relapse, and implement proactive strategies to maintain sobriety. By understanding the cyclical nature of addiction and the importance of ongoing self-care and support, clients develop realistic expectations and strategies for long-term recovery. Example: a counselor might educate clients about the neurobiology of addiction, the cycle of addiction, and available resources for recovery. Thank you for your time, and I hope you liked the video. Please share, subscribe, and like the video. It will give me motivation to create more contents like this and to help you help your loved ones. Stay tuned for more.